to Breast Cancer Resource Center's discussion of cancer and the COVID-19 vaccine. My name is Elaine Gonzalez, community educator. We are so honored to have with us today Dr. Jeff Yorio with Texas Oncology Austin Central. Dr. Yorio is board certified in medical oncology, hematology, and internal medicine. He is actively involved in clinical trial research for melanoma, head and neck cancer, renal cell carcinoma, and prostate cancer, with publications in the areas of melanoma, lung cancer, and colorectal cancer. He completed his residency in internal medicine at UT Southwestern Medical Center and his fellowship in medical oncology and hematology at UT MD Anderson Cancer Center. He was awarded Austin's Top Doctors from Austin Monthly in 2020 and 21, the Healthcare Innovation Award from Health Tech Austin in 2020, the Rising Star Award from US Oncology Research in 2019, and has an extensive list of publications, accolades, and additional awards. Thank you, Dr. Yorio, for joining us today.
Thank you for having me.
Well, let's get started with some questions.
Okay.
Most vaccines we take either a weakened strain or a dead portion of the virus to help the body recognize and then later fight it when it comes into contact with it later. The COVID vaccine has neither. How exactly will it later recognize and fight COVID versus healthy cells if the vaccine isn't the actual virus? And how does the vaccine work in the body?
Sure. So of course, at this time, the two approved vaccines are from Pfizer and Moderna, and both of those vaccines are what we call mRNA vaccines. And so mRNA, to try to take you back to biology, is, if we think about cells, inside of our cells, we have DNA, and those are like the backbone of all of our cells and our makeup. And DNA actually will code RNA, which then gets sent out to the outer part of cells, and RNA then actually will eventually get coded into proteins, which actually do all the functions in our body and things like that. And so this particular vaccine, what they've done is they've made a strand of mRNA that can code for the protein, which is the spike protein on the COVID-19 virus. And they've hidden that mRNA inside a little package, a little lipid particle, basically. And so when that gets injected into somebody in their body, those little packages get delivered to the nearby cells, mostly the muscle cells of your arm. And those cells will take in that package, and then the mRNA from that package gets taken out, and then it gets transcribed into protein. So your own cell actually takes that little message and turns it into protein. It never gets anywhere near your nucleus, so it has no way of getting close to the DNA or altering any of the DNA of people's cells whatsoever. I know I've heard people mention that, but there's no way that happens. And then actually mRNA doesn't live very long, so once it gets coded into this protein in the cells, the mRNA gets destroyed. So I've said it's kind of like Mission Impossible, where you get a message sent and it will self-destruct in 5 minutes or something like that. And so that mRNA should disappear in your body, so it's not around anymore. But it will have coded these proteins, these little proteins that are mimicking the spike proteins on COVID-19, and those get delivered to the outer portions of the muscle cells. And then your immune system recognizes that as foreign. It says, well, this shouldn't be here. And so that will generate an immune response. And so they see these foreign proteins there, and then your body starts to make antibodies against those proteins because it doesn't like that they're there. And therefore, the thought is that if you were to get exposed to the actual virus, now you've already got these antibodies and this immune response to it. And so not fully, a lot different maybe from other vaccines, because they kind of do a similar thing. But in this respect, you're using a slightly different mechanism to make your immune system recognize what's going on. And it may actually be a more efficient, better way ultimately to deliver vaccines. And the thought is that it might be in the future, many other vaccines will start to move towards this mRNA type mechanism, but we'll see.
Well, that's fascinating, because I know many people are afraid they're going to get COVID or get the flu or any of the viruses that when they receive those vaccines. So I'm sure a lot of people are really happy about hearing about that.
That's right. Yeah. So in this case, there's the virus itself is not at all in the vaccine. So there's no way whatsoever to actually get the virus from the vaccine.
So why does it change the way your body reacts to the vaccine?
You mean as far as why you get sort of a side effects or reaction to it? Or?
Correct, yes.
So, it is generating this immune response. And so when it does that, your immune system will start to set off this response. And when our immune system sets off a response, it can cause things like fevers, it can cause things like body aches. And much like when you actually get a real virus like the flu or like COVID-19, some of the symptoms you have, like a fever, are actually your immune system trying to respond to that virus, right? And so in this case, your immune system's responding to the vaccine, hopefully generating immunity to it, basically. But you get some of those, potentially can get some of those side effects, like fevers, like chills or body aches. They don't tend to last very long, maybe 24 to 48 hours if somebody does get some type of reaction. And not everybody is getting those reactions.
So having a fever is not always a bad thing.
Correct. Yeah, it might just be an indication your body's generating some immune response.
So why should we take the vaccine?
Well, what we've seen, of course, is COVID-19 is an awful virus. Of course, it's affected the world in many ways over this last year. And the big problem with COVID-19 are two big things. One is it spreads really quickly from person to person. So it's a very rapidly transmittable virus. So that's a problem. And then for some people, it can be an extremely dangerous virus where it's obviously been a deadly virus for some. It can cause an awful respiratory infection. And then for many others, it can cause, they may not die from the virus, but they get very sick. They're in the hospital for some time. Or even if they're very sick and never have to go to the hospital, it really can affect them in many ways. And what we've seen from COVID-19 is also, for some people, it will cause some lingering effects for even months after they get the virus. So it's been obviously a very terrible virus that's spread around very quickly. And so if the vaccine can help decrease the spread and also decrease, if you were to get exposed to the virus, decrease the risk that you'd actually get infected, or it may even, some people may still get some infection, but it'd be a very mild infection as opposed to one of these major infections, then it's done a great job, and then it gets us closer to getting back to a little normalcy in life because it's not spreading around as fast.
That's the hope.
Yeah, definitely.
So, and can you go over again what the side effects are and if there are any side effects that are a little kind of rare, but that they're seeing?
Sure. Yeah. So, probably the most common thing is probably a sore arm. Like many vaccines, people get an arm sore, their arm will be pretty sore. This one in particular, maybe even a little bit more so, where you get more of this pronounced soreness in the arm for a day or two after the vaccine. Right now you have to get, it's a 2-shot series. So the second shot's probably the side effects are a little worse than the first shot. And that's because your body already has some of this immune response to the first one. And so when it sees the second booster shot, it probably has a little stronger immune reaction to it. And then of course we see things like fevers, sometimes body aches, sometimes chills. Those are probably the most common ones. Just sort of a fatigue or malaise for a day or two. And it varies from people having no side effects to people having a lot of those type of side effects, but typically within 1 to 2 days goes away. As far as major rare side effects, there haven't been a lot of just, really big, bad reactions that were noted on the clinical trials. There's always a little risk with any of these vaccines that you could stimulate some autoimmune type responses that could potentially, cause some problems. But they haven't necessarily seen a lot of those happen in the trials or with other things. So.
That's good to hear.
Yeah.
So, and how effective is the vaccine?
So far, it's been shown to be extremely effective. What they saw is if they looked at people after they got the second dose of these vaccines, about a week or so after that second dose, and we're comparing them to the people who didn't get the vaccine on these clinical trials, it was about 95% effective. So meaning of the groups that didn't get the vaccine versus the ones who did, they were 95% less likely to have developed a symptomatic COVID-19 infection. What's been even more, 95% is a big number, but what's even more striking with these vaccines is that In the vaccine arms, we haven't noted any deaths from COVID-19, so that's a huge win, and basically no hospitalizations, or so your risk of getting an extremely severe illness from COVID-19 becomes very, very low. So so it seems to be extremely effective, because if we can limit, obviously people dying from COVID-19, if we can limit hospitalizations, then it's done a huge amount of work. And even if it turns into just a very mild infection that you get later on, that's doable compared to something of what we've seen it doing otherwise to many people.
So it doesn't necessarily mean that they will not develop symptoms at all, which that's the goal. But if they do, they could be very mild.
Correct. And it was very effective, again, probably 95% effective in not developing symptoms at all. So it's very effective in that. But even for the people who did ultimately develop symptoms, it seemed to be a much milder course, which is reassuring. So it may not be 100% effective. Pretty much nothing we do is ever 100% effective. But it's, really good at preventing the big problem. When I think about this disease, the problem is the fact that it can be a fatal disease, or it can be something that causes these severe hospitalizations, severe illness. And if we can prevent most of those from ever happening, it's a gigantic win.
That's a hopefully, enough people take the vaccine, correct? So we get to that point.
Yes, for sure.
Is there a difference? So you mentioned Moderna and Pfizer vaccines. Is there a difference, and is one of them better than the other?
The two, they did two kind of big separate clinical trials, of course, where they're comparing their vaccine versus doing nothing. So there's no trial where they went head to head against each other for that comparison. If you look at the two trials, they seem to have kind of very similar efficacy, effectiveness, similar side effects, and so really there doesn't seem to be a big difference. And mechanistically on how it works, they're both mRNA viruses. So to me, there's not probably a gigantic difference between the two. Pfizer's given 3 weeks apart. The Moderna one is given 4 weeks apart. Those are the kind of those differences. There's a little bit of logistical differences with distribution and how they have to be stored and things like that, but that's not necessarily something that people out in the community have to worry about as much as people trying to get it distributed and everything.
Great. So if let's say I received the Pfizer vaccine, the first dose,
mm-hmm.
and it's the second dose, and do I need to get the same vaccine, or can I get the second dose of the other vaccine? Does it make a difference?
Ideally, you'd get the same, and that's just because that's how it was studied and what we know about. There's been some discussion that probably you could cross over because there's some similarities there. Right now, that wouldn't be recommended. You'd like to get the one that you received, and what they're really trying to do, a huge focus with the second vaccines are, for every first dose that's given, they're trying to make sure that people will have a second dose. And, the idea is going to the same place to get it, and hopefully they'll have the same type there. And so far that's been pretty consistent as far as I've heard. I haven't heard of a lot of people being forced to have to switch or anything like that. Maybe that becomes more of an issue down the road, but right now that hasn't been a big issue.
Great. There are different COVID strains that are mutating. With the current vaccines, will the current vaccines have an effect on them? And what is the plan to ensure that those new strains are being dealt with?
So it's still a bit of an unknown. So a lot of these, so it does seem like these vaccines do have some effect even on these other strains that we've seen so far. Probably the biggest changing one has been this strain from South Africa, the South African strain. And maybe there may be a little bit less effectiveness of the vaccine against that strain. But again, it may be that we're still not going to see the severe effects, so maybe that we're going to see, maybe the efficacy is not going to be quite 95%. Maybe it's a little lower as far as who gets symptomatic infections. But again, it seems like it's still curtailing the more serious illnesses. From what we know so far, that still remains to be really studied better, because when they really studied it on the trials, that strain wasn't around as much. And then this is kind of new knowledge that they're still trying to learn and trying to develop. And so hopefully, I mean, we'll continue to learn more about these strains and how they might interact with the vaccines. And of course, the risk is, yeah, if there's more and more strains that develop, do some of those eventually, does the vaccine not respond to those? And so all the more important reason to me is if you can start to really curtail the overall illness in the population, get the numbers of infections down dramatically, the chance that you'll get all these new strains to continue to develop is going to be much lower.
Much lower. Okay, great. So I want to get to some questions about cancer patients. Are cancer patients at a greater risk of contracting the virus because they are immunocompromised?
Yes, I mean that's I don't know about not necessarily contracting the virus, right? If you because it's something that's very prevalent and seems to pass easily from person to person, but I think they're more susceptible if they get exposed to the virus, and they have the risk of becoming much more sick because they don't have that same immune system to potentially fight off a virus. Much like we tell them with other types of infections. So this is kind of the same, that their risk of having a worse infection is worse.
Phase 1B includes those with chronic diseases and cancer. So when are cancer patients far enough out from treatment where they don't fit into this immunocompromised category?
Yeah, and that's it's kind of a tricky question on how they've phrased this because they put cancer patients in there, which obviously we want them to be. And the question is like you're saying, well, when am I considered not a cancer patient anymore? Or, I think to us, people are always considered a patient who's had cancer. And so we're on these different guidelines. And it's a little bit nebulous, to tell you the truth. Now, if you're thinking about who's going to be the highest risk, it's definitely people on active treatments like chemotherapy, immunotherapy, all these things. They're probably at the highest risk while they're on those types of treatments, or within probably the 6 months after they receive those treatments. So that's probably their highest risk period. Definitely similar to people who had bone marrow transplants or things like that are going to be at higher risk right around that time and for the first sort of 6 months to a year afterwards. As you get further away from those kind of intensive treatments, probably you're not very immunocompromised anymore. Your immune system starts to build back up and starts to approach that more of somebody who didn't have cancer before or doesn't have active cancer anymore. So I would kind of say, within the first, after about 6 to 12 months after their aggressive treatments are probably when they're returning more to a true, less, more normal state, I guess, if that makes sense.
Perfect sense. So what can you say to cancer patients currently in active treatment and those out of treatment to reduce the fears surrounding the vaccine?
Sure. I mean, I think, to me, I think the two vaccines that are currently approved have been studied fairly well. I know it's been a shorter time frame, but most of the effects we see from vaccines tend to happen in a very short period of time after the vaccine, as opposed to months or years later. So we've already gained a lot of knowledge about it, and we've already had, even on clinical trials, they had tens of thousands of people on all these clinical trials. So a lot of people to look at. Compare that to some of our cancer trials. We're excited if we have 500 to 1,000 people in a clinical trial, cancer research, and drugs will get approved for cancer research based on far less patients. So it seems to overall be pretty safe. There's always any medicine, anytime we introduce anything to our body, there's always some risk, of course. And to me, I'm always weighing risk versus benefit. The risk of this virus is huge, and the chance that people can get sick from the virus, especially patients on active treatment with cancer, is very large, as opposed to what any risk they would have with the vaccine. So to me, that benefit of getting the vaccine far outweighs any sort of risk involved.
Great. If I have lymphedema, can I get both vaccines in that arm?
Good question. I mean, I think ideally you'd probably try to do it in the other arm just to be safe. Just because it could potentially stimulate a little bit of an immune response and make that lymphedema a little bit worse. It's not something that's been well studied, but we try to, just like with other things, we try to limit interventions on that arm. And I think if you do have active lymphedema, better to try to do it on the other arm.
Both injections?
Both injections, yeah.
Injections.
And okay to do both in the same arm for sure.
Great. Okay. So what do you say to the conspiracy theories? The vaccine contains a microchip, or the vaccines alter our DNA. I know you've talked about the DNA already, but there is that theory that they're trying to inject microchips.
Well, first of all, my big response to that is we all have a microchip that we walk around with every day, which is far more powerful than anything they could ever put in a vaccine or anything like that. Trust me, if you're worried about microchips, you're walking around with one probably constantly. But anyway, I don't, yeah, there's certainly no evidence that there's any sort of microchip involved in these types of vaccines, or that there's any sort of government conspiracy. They're trying to track you down with these vaccines or any of those type of things. And so, I think just unfortunately a bad conspiracy theory. And as I said, if you're worried about those things, you're probably way more exposed than you ever think for other reasons. So, and the vaccine's not going to be it. And then, as I said about the DNA, these vaccines have no ability to actually get into the DNA of our cells. So there's no way that these are alternating your DNA.
Great.
I was just gonna say there's going to be, of course, there's newer vaccines on the horizon as well. And we learned a little bit about the vaccine from Johnson & Johnson. They had a press release last week, and probably will publish more information this week or next week. And potentially that gets FDA approved here in the next 1 to 2 weeks. That vaccine works a little differently, but also seems to be very effective, and will be another good option, and may only have to be 1 shot as opposed to 2. So.
Okay. Great. Thank you for reducing our fears around that. Can you speak to the fear of the minority population that are worried about getting the vaccine due to mistrust of the medical community?
Sure. I think it's that's always been a longstanding issue. Anytime we think about clinical research and those things, is how do we get trust in the minority community with that? And unfortunately, there was history long ago where the medical community, where the minority populations developed some of that mistrust, which was certainly warranted because of some of the ways some research got done, over 50 years ago, essentially. Fortunately, the ethics of things have changed and are much better now than they probably used to be many years ago. And to me, I think the minority populations have been hit very hard with COVID-19. What we've seen is in both the Latino and Black populations, COVID-19 is even a higher risk disease in those populations. We've seen a little bit higher death rates. We've seen higher amounts of hospitalizations in those particular groups. And so I think all the more important reason to really think about getting this vaccine for those populations, because I think it's really important to try to prevent them from getting those serious illnesses. I think obviously minorities were included in the vaccine trials, but not probably to the extent that we all would have liked to have seen. We would have loved to have seen more minorities be involved in those trials. And at the end of the day, I think, as a medical community, I hope people realize that our interest is your interest. Our interest is always trying to do whatever's best for our patients and the people out there, and trying to prevent illness and make illness better. And so really, I think as a large community, people have the best interest at mind. And I think that's really the goal here, is trying to, how do we get past this awful disease that's happened and get things to a better point.
I agree. You may not be able to answer this question, but do you know what kind of plans there are for distributing more of, or making the vaccine more available for those who can't get online and register online, keep refreshing and figuring out the system? I mean, even I've had time of it. So do you know of any plans future?
Yeah, I mean, it's, I think a lot of it's a supply issue, how much is available. And right now I've likened it to, we're all trying to get inside of a football stadium, but there's only one gate, and it's going to take a long time for all of us to get through that one gate. And unfortunately, that's where we're at now. There's only one gate open, and we're all trying to get to that same point. And eventually, we'll all get inside the football stadium, but it's going to take a long time at the moment. And I hope that speeds up. And as we get more vaccines approved, that will be helpful because we'll have more supply available. And hopefully, it'll start to get passed out to more distribution points. I think what they're trying to do right now, especially in Texas, has been really trying to focus on these hub models where you have these big centers giving out vaccines, as opposed to less so like places like our clinic or places like your local pharmacy. And so what I hope to see, and I think eventually we'll see over the next 1 to 2 months, is as there is a little more supply, we'll start to see more of that, where your doctor's office will start to get it. More so your pharmacies will start to get it, and then the access points are smaller places, maybe a little easier to access, because I've certainly struggled with my own patients, especially those who are older, who definitely should be getting this vaccine, but they can't get online to do this, or it's complicated, or they don't want to go to a center where there's 1,000 people waiting for a vaccine, and they'd much rather, since I have them in clinic, it'd be great if I could just give them the vaccine right then. And so I hope that will continue to change. I think there's new policy going around really trying to push it out to some of the pharmacies, maybe hopefully over the next 1 to 2 months. So hopefully we'll start to see that. And to me, it's really just the supply issue. If we get more supply, we'll start to get it distributed more.
Great. One last question. Will the vaccine turn us into zombies?
I don't know. I guess it depends on how many zombie movies you watch. But yeah, no, I don't think, no zombies. I had the vaccine and I've had doses. I haven't turned into a zombie yet. So,
there's those that believe there is going to be a zombie apocalypse, and they're prepared.
There you go. So I guess then we'll all be zombies together. So there you go.
Thank you so much for taking the time to answer our questions and share information of vaccine.
Yes, thank you for having me, and hopefully everybody goes out and gets one.